Welcome to Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. This is that one place, that one time each month where I answer your questions. Orthopedics, injury, surgery, rehab, recovery, maybe health, wellness, whatever it is you have, I will try to answer it. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injuries. Very excited to be here. Hope you've had a wonderful, wonderful week as we wrap up the week. If you missed the webinar a few weeks ago, it was a little less than a couple weeks ago, on how to get rid of joint pain in as little as 30 days without cortisone shots, surgery, or other treatments, sort of the conventional treatments. We have another one of those coming up toward the end of September. This time we're going to try a Tuesday early evening Eastern time to allow a different group of people to get there, because not everybody can get to YouTube, or not YouTube, but get to an online webinar at noon Eastern time. So definitely join for that. Before I start answering questions, please remember I am not giving you medical advice. This is meant for general information and educational purposes only. I haven't seen you, examined you, looked at x-rays, MRIs, or anything like that, so I am not giving you specific medical advice. It's intended for you to have more information about that topic so that you can ask your doctor or your orthopedic surgeon, hey, what about this? And just basically know more about it. I am not telling you what to do. Georgia, it's great to see you. Thanks for being here. I hope you're having a great weekend. All right. Sternoclavicular dislocation, and I got to tell you, I can't read really long ones word for word. Sternoclavicular joint, 18 years old, grout plate injury. I honestly don't know what that means. And again, I can't give you a suggestion. Sternoclavicular dislocations, what that means is that's the joint. If you're looking at a shoulder and you've got the collarbone coming across, it's where the collarbone meets your sternum or your breastbone. So it would be right there. There's one on either side. Anterior sternoclavicular dislocations, where the clavicle comes forward, albeit there's a bump there, there's nothing really to be done about that. You just leave it alone and it very quickly becomes not painful. If it pops in and out all the time, in theory, sometimes there can be a surgery you do, but most of the time an anterior one just stays out. You leave it alone. There's not really a great way to push that back in and hold it in place. There is, but the risks outweigh the benefits in terms of surgery. Now, one that is what's called a posterior dislocation, where the collarbone is pushed behind the sternum, almost always has to be treated surgically. Now, it could be just a thing where they pop it out through a closed reduction, sort of make you sleepy, kind of move your arm in a way that pops it back out, and that may be enough. But if that doesn't reduce it, then you need to do an open surgery to go in and move the clavicle on top of the sternum, because then if you leave it in place, that collarbone is pushing up against the blood vessels that come off your heart. It's very close to your trachea and esophagus, really bad structures, and over time, in theory, it could erode into those areas, so that needs to be done, again, typically surgically. Those are pretty uncommon. Almost everybody has the anterior ones that, other than the prominence, there's nothing worrisome about that. And as far as I'm aware, really no orthopedic surgeons routinely go in and treat those surgically. All right. How many days are required for meniscal partial full tear? It would really depend on what type of surgery that was. So if you go in and about 85-90% of meniscus surgeries involve a scope where the surgeon goes in and trims out the part of the tear, there's really no restrictions in terms of weight bearing and activity, other than it's a little uncomfortable. If it's the type of tear where they sewed it together with stitches, which is a true meniscal repair, then very often the surgeon will keep the patient non-weight bearing and limit activities for 2 to 4 weeks or longer. So it really depends on which of those it is. The risk is if you put it together with stitches, held it in place with stitches, and you did too much on it, you break the stitches back up, and the tear is essentially there again. But if you trim out the part of the tear, which again is the very, very common in the United States and most of the world, there's really not a huge risk of physical activity after that. Georgia, having rheumatoid, I assume rheumatoid arthritis, RA, and possibly other autoimmunes, having ACL operation, what's better, gym or swimming? I don't know that I feel really strongly about that. Swimming is nice because basically there's no weight on the knee at all. So it's great exercise in the recovery phase of an ACL surgery, but there's a lot you can do in the gym after surgery. You just would want to talk to the physical therapist and avoid things that potentially put stress on the graft. But certainly in that first 6-8 weeks, maybe even up to 12 weeks, maybe swimming might be a little bit better. Mary, it's good to see you. Thank you. I missed being here as well. That means a lot. All right. Got bone patella tendon bone graft meniscal repair yesterday. Have never experienced this much pain in life. Anytime you take the patellar tendon, which is, they take the middle part of this patella tendon with a piece of bone on either side, it's going to be uncomfortable. Plus, in an ACL surgery, you're passing that graft through drill holes in the femur and the tibia. And yes, it's uncomfortable. Typically, in the United States, we do blocks that usually give people pain relief. Anywhere from the first few hours after surgery to sometimes 1 or 2 days after surgery. I'm a big fan of having the anesthesiologist do that if the patient consents to that. So that can help get people through a lot of that pain. But yes, that can be pretty normal. Mahmood, India, scaphoid fracture 3 months ago. Wrist still not, I don't know why that got small all of a sudden. Wrist still not functioning. Doctors not suggest cast. No, you can't. I don't answer questions by email, so I can't do that. But typically, scaphoid fractures, if they're not healing, very often need surgery. Now, it depends a little bit on where in the scaphoid. That's a bone. I don't know where. Do I have a wrist model? Yeah. That is this bone right there, sort of at the very much sort of the base of your thumb. That's the scaphoid, and that can be a tough fracture because fractures there very often need surgery. 3 months out, if it hasn't healed, it could. But the problem with scaphoid fractures is they have tenuous blood supply, and so they're prone to not healing without surgery. Not sure what the question of this is. Getting pain on the outer region of the knee. If there's a question to that, certainly send that. And this is driving me crazy because now it's small enough that I can't read it. Sorry about this. 6 months notice grinding sound in my right shoulder when I raise my arm. Any idea what's happening? No pain. So a lot of times it's not that you have bone on bone rubbing against each other. What happens is you get a little bit, let me take this off the screen for everybody. You get inflammation of the bursa that runs under the tip of your shoulder blade but on top of the rotator cuff. That bursa tries to help avoid what we call impingement of those rotator cuff tendons against that the acromion, the tip of your shoulder blade, and with repetitive movements that cause aggravation, basically inflammation and pain, that bursa can become sort of thickened, and then you get sort of what we call crepitus, or a grinding sensation with range of motion. And that typically is what popping is in a lot of people. Not always, but that's probably the most common thing. It doesn't typically need surgery, though. Usually it can get better with physical therapy to strengthen the muscles around the shoulder and basically limit a little bit of that pressure and that grinding in the bursa and between the rotator cuff and the acromion. Dennis asked, can Pectusexcavatum be fixed in adults? I have never heard of that surgery being done in adults. My guess is that would honestly be more the cardiothoracic surgeons than the orthopedic surgeons, because being right around the heart and aorta and all that, that wouldn't be something orthopedic surgeons would tackle. So orthopedic surgeons would probably say no, but maybe there are cardiovascular surgeons that might do that. Non-surgical treatments to help straighten the knee, or does it require surgery? That's a depends on the situation type of thing. If you've had a surgery and it didn't go all the way flat and now you're 4 or 6 weeks or more past that, yes, it almost always requires surgery. If you were in a cast too long or something that kept your knee bent for a long period of time, basically the short answer is, albeit again there's a lot of variables as to why the knee is not all the way straight, but if it's been bent and stuck bent for more than about 4 to 6 weeks, it's really tough to get that with physical therapy or any kind of device that helps to extend the knee. That usually requires some kind of surgery to treat that. I think I answered that one. And then let's see, how much after ACL surgery can I play football? Is 9 months safe? The amount of time, it's funny, I get this question about once a month. The amount of time is not really what we use to go by. It's really when you can do certain activities with no difficulty, basically sport-specific activities, when you have your strength back to the way it is on the other side, or at least 85% of what it was on the other side. A really good sports physical therapist can really help get you in the return to sports phase and help decide along with the orthopedic surgeon when you're ready. Typically, yes, 9 to 12 months is enough, but you could just sit on the couch for 9 months after surgery and be nowhere near ready. So it really depends on how the knee is doing functionally. Luke asks, what does a bone scan really help with? Bone scans typically, we've really kind of gotten away from that. There's DEXA scans for bone density. We've gotten away from the old school bone scans to use MRI because that shows soft tissue much better. There may be some old school uses, but I don't know too many people that use them much anymore. In general, gym versus swimming, I think was the question. The thing I like about the gym is that there's resistance training. It helps increase bone density. It's probably a little bit better at building muscle, which is important as we get older. But I think there's a kind of a role for both because, and it depends a little bit on what we're talking about in the gym. When I hear gym, I'm thinking lifting weights, where there's not that much cardiovascular benefit, in lifting weights. So I actually like them both, but it's not really an either or. Swimming is one of the best cardiovascular exercises. Lifting weights, it's hard, or machines or other forms of resistance training, it's hard to beat that as well. So that's why I like them both, not just I don't feel strongly. Swimming's a lot harder. I feel like gyms or lifting weights is probably easier for most people. All right, that looks like it. I very much appreciate it. I will see you guys back here a month from now on a Friday. I think it's the 29th, but I may not be right about that. And also check the YouTube channel. I have an upcoming webinar also toward the end of September. Got great feedback, great participation, lots of questions the last time that I did that. How to get rid of joint pain in as little as 30 days without cortisone shots and surgery. I think you'll learn a lot, sort of learn why some of the conventional treatments that almost every orthopedic surgeon uses may not be the best for you, and what else is out there that might be better. So definitely check that out. In the banner to this channel, there's a link in the channel art, and that'll take you to the sign up page. It's completely free, but I would love to have you there. Have a wonderful, wonderful weekend. I look forward to seeing you very, very soon.